Hello, my name is Estevan. I am a licensed physical therapist at a outpatient private practice clinic. I graduated from UIC in 2017 with a bachelor's degree in kinesiology with the exercise science and health promotion specialization. After I graduated, I then attended Governor State University to get my doctorate in physical therapy, and I graduated from there in 2020. Some of the main responsibilities that I have as an outpatient physical therapist involve evaluating and treating individuals who come in with primarily musculoskeletal injuries. These injuries could be the result of a work-related injury, a car accident or a fall, for example, or a sports-related injury. So after we evaluate these patients, we then develop a rehab program for them. And we carry that out, and this will oftentimes involve overseeing a physical therapist assistant that often works with us, or a rehab technician who could also be working with the patient. So you'll have to oversee the treatment through them. It'll often involve a lot of educating to the patient, to their family, some communication with their primary care physician. Um, it'll involve a lot of motivating for individuals who come in and are in very vulnerable states, so it's important to be a motivator and to be a very good listener. So a quick snapshot of a typical day for me would be me coming in early to take a look at my schedule for the day, doing some research through the electronic medical record for patients that are coming in for their initial evaluation that day. It would then be seeing current patients and progressing them through their rehab program through more challenging or less challenging therapeutic exercises depending where they're at. Um, it would involve documenting all the interventions that we did that day for each individual patient on their electronic medical record, and then also making sure we're staying on top of CDC guidelines and clinic guidelines, especially with cleaning and sanitation during a current pandemic. So I would say some insider scoop on my job as a physical therapist in private practice would be understanding insurance and insurance benefits, as boring as that may sound. It dictates a lot of what we can do as physical therapists with patients, especially in areas with varying socioeconomic class. It's important to be conscious of that when working with people and understanding that healthcare is expensive, and being upfront about it, being transparent about it. So I would say the best part of my job would be a patient's last day with us, as odd as that may sound. Um, but there's something very rewarding about getting to see someone walk out of the clinic who originally came in, say, with a walker or recovering from a stroke or had a really gruesome work-related injury, and was on crutches, and now they're able to walk out of the clinic and not complaining of pain anymore. That's very rewarding to me, and that's something that I really like about my job. Um, some key traits I think would be beneficial to have an edge as a physical therapist would be being a very good educator, especially during initial evaluation. It's important to have a good understanding of anatomy and physiology, and I think it's important to be a great teacher to teach your patients and their families about everything they're going through. Um, I had a position as a tutor at the ASAP office, which I think helped me out a ton, especially now. Another would be being a good motivator. You're seeing people in very vulnerable states, so it's important to motivate them and really get them going. I think that's very important too. So how I actually got hired for my job is actually pretty interesting and kind of an outlier, considering it was during the COVID-19 pandemic. Um, After I graduated, I didn't get my job until like 5 months after. And it ended up being I was cold sending my resume to local clinics around me, and I got a call back from this clinic and had an interview with the owner, and the owner ended up knowing other physical therapists that I was on clinical with at other private practices in graduate school. So it's pretty important to network when you're on clinical, and then know your local physical therapists. Some advice that I can offer to prospective physical therapists out there would be to first and foremost make graduate school as affordable as you can make it. If it involves taking a gap year or two in between, you should not feel discouraged. And secondly, would be to practice a movement. Um, it can be lifting, running, dancing. It'll serve two purposes in improving your health, but also improving your knowledge of movement, which you're going to use for the rest of your life if you're in this field. I think prior to graduating from UIC, it would have been beneficial to have a seminar or a course on the United States healthcare system and the economics involved. We don't get taught a lot of it in undergrad or even graduate school, and I think it's something that would be beneficial, especially with a lot of AHS graduates going into the healthcare field.